Hi everyone. Um, I'm just now starting to do the deep dive into baby N. Baby N was a hemophiliac. Yes, they allowed a hemophiliac baby onto this unit and kept it there. And by the way, they didn't have enough of what we call factor 8. That's what hemophiliacs are missing. That helps, factor 8 is what we have. Helps us clot blood. They I don't either they're deficient of it or they don't have enough of it. So that's why this baby basically has all the baby's blood, and they blame Lucy on this. And yet they did not make sure their pharmacy was supplied with enough factor 8. Now, what really, really, really even bothered me more as I'm looking at this was the time they introduced the text between Lucy and that bastard registrar, Dr. A, that tried to get into her pants. This was the one about going commando. And then even further down in the texts, he's saying to Lucy, I want to ask you something special. And I think we all know what that special is. And at times like this, when I'm so bothered by not only was she accused of trying to kill this baby who was bleeding to death in front of them. They couldn't get an airway into this baby. They didn't have enough clotting factor for this baby. They had to call in Alderhay and literally run in an ENT doctor to possibly put a tracheostomy on it. The fact that this baby, I'm looking more and more now, there's something that is irrelative or insensitive and not relevant in the mother's history. So I'm even questioning if this mother was on possibly medications for things um, that she would want to keep private, that she needs to keep private. I'll show you the medical record on this baby, and it's disgusting. They even gave this baby a paralytic agent. It was suffocating. It couldn't breathe while attempting to intubate it. So it was actually suffering. Now, in addition, what I've seen on something on Facebook is that they overdosed this baby by 10 times the amount of morphine it needed. They couldn't even correctly figure out the correct dosage of morphine and gave it probably 10 times. So at times like this, what I do is I kind of just sit there. I'm going to go take a nap with the Empress. And she is my therapist. Well, she's my Empress, of course, but she's also my therapist. And so times like this, I'm just going to warn you, it's going to be very disturbing when we go deep dive into baby A. Find yourself an Empress, like I have. It makes all the difference in the world. Could be a cat, could be a dog, could be a loved one, something to do that. And just an FYI, Empress is not her name. Her name is actually Nuisance. Yes, as in that she was a nuisance. She was a stray in a trailer park, and she became a nuisance to that trailer park because anyone would open it up, she would run into their little trailer and try to steal food to survive. That was her survival tactic. Now, kind of one of the reasons I haven't told you her other backstory is that she's got something called feline leukemia virus. And what that is, it's a virus. It is a retrovirus. It's actually a first cousin related to the AIDS virus. So she is actually immunosuppressed. So what I do, and that's just my way of doing something for the community. Most often these cats are automatically euthanized because Eventually, only a third of them will live a normal life, but two-thirds of them will die due to immunosuppression, just like an AIDS patient. And there really is no retroviral medications that you can give them. You just basically keep them as happy as you can for as long as you can, and then you decide when when they're starting to suffer, when they become immunosuppressed, what you need to do. This is my third cat, my third, what we call them Feluke cats. Again, and they are just so sweet. But again, no one wants to adopt them, but I'll do it. But again, my first one was Jasper, and he was the sweetest thing, and I kept him alive until he was 14 years old. I shouldn't say me. I should say I have a wonderful veterinarian. Um, and then and then when it came time, we knew it was time. I know when they start to suffer, and I will pick euthanasia for them if I when both my vet and I both agree that it's at a point where it's just cruel to keep them alive. And my second one was Memphis. And the reason I named him Memphis is that I used to live in Memphis. I lived down there for 7 years. And there is nothing more wonderful than taking care of patients in the halt of the absolute area of what they call the Mississippi Delta. I was actually that was a time when I did home care. I would actually go to people's homes. I didn't go to rich people's homes. I went to poor white rural homes and inner city black homes. And let me tell you, those people, that's where I got my heart and soul as a nurse. They all of them all grew up poor. Um, the black ones grew up during the era of Jim Crow, segregated South, and yet you would never know these women. They just were the strength and just taught me an awful lot. You know, what they had to endure in their life. And yet I would go in and take care of them. They were 80 and 90 years old, and yet you would never knew what they had to endure. And this is one of the reasons I'm very, very hopeful about Lucy, because they what they endured had to have paralleled much of what Lucy did, and yet they had the strength to be the most incredible, wonderful ladies that aged better than any fine wine. Lovely. And often what I would see, although they were too sick to go to leave, because that's why they had to have a nurse come in to do it. But often there you would see their neighbors, these little ladies with not two pennies to their names. It was I worked the weekends, and it was usually on a Sunday, and they would dress up in their finest, carry their Bible, hold their heads high, and go to church. And to them, faith is what got them through horrendous, horrendous times. During those times, they were part of that civil rights movement in America, the ugliness of that. And yet, I think it was faith that got them through. And again, held their heads high and were the loveliest of loveliest women. I enjoyed those times. I enjoyed my 7 years we lived in Memphis. In fact, I was really upset when we had to move back. And the reason we moved back is that both sides of my family had disability and elderly family members we needed to take care of, you know, and take care of families. And that's why we moved back. Otherwise, I'd still live in Memphis. And and if you ever get a chance to go to Memphis, there is you can't get any better music than the blues that comes from Memphis. Bye bye.